joining us now, White House Senior Advisor for COVID Response, Andy Slavitt. Thank you very much for being on the show this morning. I see it's snowing. We appreciate your coming out. I think there's a lot of questions about how this vaccine can get to the American people at a faster pace. Can you update us on where we are exactly?
Yeah, thank you. Thanks for having me on this morning. We are in a shortage, and I think it's important that we not lose sight of the fact and that we level with the public that for the next at least short period of time, we're going to be in a shortage. What we have done is we've focused in three areas. We've focused on how to increase the number of vaccines coming, and we've increased in our 3 weeks here the number of vaccines going to states by 28%. We've also just this week shipped 1 million more vaccines, starting a retail pharmacy program. We've opened up community health centers program that Congresswoman Demings has been talking about. And we're opening 100 federally sponsored sites in communities across the country, and we're getting more vaccinators out there. So the good news is we are gaining on it. The bad news is we're gaining on it a few yards at a time, and the public obviously wants this vaccine as fast as possible, as do we. So we are pushing and seeing it grow every week in every state, and we're pleased to see some of the progress we're seeing, but we need to do more.
So, Mr. Slavitt, I was talking to people connected with the Biden campaign in early December, talking to people on the transition team, and they were deeply concerned in late November, early December, that the previous administration had botched the vaccine rollout, and were deeply concerned. Just so we understand and we have proper context to where we are in February, what were some of the challenges that the Biden team that you faced regarding the vaccine rollout plan when you finally got into office on January the 20th?
Yeah. So I think we've been led to believe, I think as a country, that we would have 40 million vaccines done by the end of December, 100 million by the end of January. Obviously, we were far short of that. You know, we came in, there wasn't a stockpile of vaccines, there wasn't as much manufacturing as we thought, and there was no plan given to the number of vaccinators, the number of sites, and monitoring of how these things were moving out. When we got here, about 46% of the vaccines that had been produced had been administered. Today, that number is 67%. So, look, you play the cards you're dealt, not the cards you wish you had when you're dealing with a crisis. And so we're not going to spend a lot of time focusing on what didn't happen. We're appreciative of all the good work that happened before us, but we've got to focus for the public on today and tomorrow and the next day. And there's opportunities every day, including the things that we talked about, how we got to increase vaccinators, how we've got to get more supply. And we now have visibility into getting all the vaccines we need to the adult population, and we've got hopefully some good news around the corner, but we'll also have challenges, and we know that.
So we had Dr. Fauci on our show last week, I think about 7 to 10 days ago, and his exact quote was, "We need to get children back in school." There has been some back and forth in the administration over the past week, some confusion on what the goals were. Candidate Biden said he wanted to get schools opened up, the majority of schools opened up within 100 days of January the 20th. Where do we stand now?
Yeah, and I watched your segment earlier on this topic, and I can assure you of one thing, that there's no debate over whether to open schools here. There's a debate over how. And if it were as simple as open all the schools, they'd all be open by now. Obviously, what the CDC is studying, and I've spent a lot of time talking to Dr. Walensky and Dr. Fauci about this, there are schools that have done it safely, and there are schools that have done it not as safely. We know that if, for example, Dr. Walensky says if all the kids are wearing masks and there's a certain number of kids in the school and there are a certain other set of conditions, we should be opened, and we should be open as much as possible. Tomorrow, and I don't know if I'm breaking any news here, but tomorrow the CDC is going to roll out their operating plan to give school districts, local communities, the guidance they need to begin to do that, and to begin to do that aggressively. I know people are impatient. Understand why people are impatient. There's a lot of parents in this building. They too are impatient. But the CDC is thorough, and the CDC, I think, is going to hopefully provide some good guidance so that schools can start to open.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.